Chapter 15, Surveillance and Outbreak Investigation, Sandra Monk. Disease surveillance has been part of public health protection since the medieval times with the investigation of the bubonic plague in Europe. And the Constitution of the United States provides for police powers that's necessary to preserve the health and safety as well as other events. And these powers include public health surveillance. The state and local police powers also provide for surveillance activities, and these are manifested as health departments that have legal authority to investigate unusual clusters of illness. Some definitions of importance are disease surveillance, and that's the ongoing and systematic collection, analysis, interpretation, and dissemination of specific health data for use in public health. And this is what the whole topic is about. And surveillance is important because it generates knowledge of a disease outbreak and also patterns, including the timing, geographic distribution, and susceptible populations. The event looks at the outbreak, and the patterns. Biological terrorism is the deliberate release of viruses or bacteria to harm others. And then chemical terrorism is the release of chemicals with the intent of harming or killing animals or other humans. And some agents that might be used are anthrax, also botulism, and ricin, and chemicals such as that. And it's important for nurses to be knowledgeable about public health surveillance because nurses are often the first ones to recognize and respond to a problem. Uses of public health surveillance. Surveillance provides a means for nurses to be able to monitor disease trends in order to reduce morbidity and mortality and also to improve health. And surveillance is a critical function for nurses practicing in the community, and it's important because it generates knowledge of disease or an event of outbreak patterns. And it focuses on a collection of processes and outcome data. And although surveillance was first devoted to monitoring and reducing the spread of infectious diseases, it's now used to monitor and reduce chronic diseases and injuries, as well as environmental and occupational exposures. And some public health surveillance can be used to facilitate some of the following: to estimate the magnitude of a problem or disease or an event, to determine geographic distribution of an illness or symptoms, to portray the natural history of a disease, to detect epidemics, such as the ability to define a problem, generate hypotheses and stimulate research, evaluate control measures, monitor changes in infectious agents, and detect changes in health practices, and also to facilitate planning. Now, some of the purposes of surveillance is it helps the public health departments to be able to identify trends and unusual disease patterns, and it sets priorities for using those scarce resources that we talk about. And it develops and evaluates programs for commonly occurring and universally occurring diseases or events. And nurses should always check data for changes and occurrences. Even if every month they check the data and it seems it's the same, that helps to establish the baseline. So when numbers have been, nearly the same for a long period of time, they still should be checked, because even then you can see immediately when there's a change in the baseline, and that there is some type of activity going on with an outbreak. And surveillance activities can be related to the core functions of public health, which are assessment, policy development, and assurance. So, for instance, one of the things that public health department might do too, public health nurse might do, she might follow up, say, if there has been an outbreak at a school with measles, or an outbreak with influenza, and he or she might follow up even several weeks later to see if they have returned to baseline. Collaboration among partners. A quality surveillance system requires collaboration among a number of agencies and individuals, and such collaboration promotes the development of a comprehensive plan with a directory of emergency responses and contacts for effective communication and information sharing. We know what we're going to do before we have a problem, and that collaboration already exists. And nurses are often in the forefront of the responses that are to be made to the surveillance process. So the type of information that might be shared includes, how to use algorithms and to identify which events should be investigated. And we would use a precise step-by-step plan outlining a procedure that has a definite set of steps to help identify the appropriate event. And we would look at how to investigate, whom to contact, how and whom information is to be disseminated, and who is responsible for the appropriate action. Nurse competencies, again related to our public health core competencies, come from assessment, policy development, and assurance. And under those core competencies are included analytic assessment skills, communication skills, community dimensions of practice, basic public health science and skills, and then leadership and systems thinking. So we're going to talk in the next couple of lectures on program planning and also on quality assurance. And so using our community assessment skills that we have from last week, that are all part of those core competencies. In the Minnesota model of public health interventions, there are applications for public health nursing in those. It suggests, in fact, that surveillance is one of the interventions related to public health nursing practice. It's a very strong part of public health nursing practice. And data sources for surveillance relate to the cases reported by the clinicians, healthcare agencies, and laboratories to the state health department. Clinicians, healthcare agencies, and laboratories all report to the state health department. And the data comes from death certificates and administrative data such as discharge reports from hospitals, and also from billing records could be a source for data. Related to death certificates, that may be one of the major sources of data in a rural setting where there's not a lot of hospitalizations from that particular area, because on the death certificate there's always a cause of death, and so that certainly is a source of data. Administrative data such as billing, and then Sentinel surveillance system provides for the monitoring of key health events when information is not otherwise available or in vulnerable populations, where we try to calculate and estimate disease morbidity. So each of the data sources has potential for underreporting or incomplete reporting. However, if there's consistency with the use of the surveillance methods, the data collected will show trends and events. So it all needs to be consistent, like reporting reportable disease processes. And we're going to look at some of those and to indicate if there has been some change, some increase or even decrease in those reported cases. National notifiable diseases, box 15.3 in your book shows the national notifiable infectious diseases. I don't think any of those will surprise you, and you might want to look at those in the book. There is a national notifiable disease surveillance system. It's only as good as the persons who report the diseases, the healthcare practitioners who report that. And reporting of disease data is essential if trends are to be accurately monitored. Now, there is, I put a link in there for you into the Morbidity and Mortality Weekly Report, National Notifiable Diseases, and that is found on the website of cdc.gov. And there's also going to be an activity to do with that related to a discussion, a threaded discussion. And it also, on there, you would find a summary of notifiable diseases on that CDC website. State notifiable diseases, requirements for reporting diseases are mandated by law or regulation. Each state differs in the list of reportable diseases, and not all nationally notifiable diseases are legally mandated for each, for reporting in each state, I guess based on, where they're, the frequency and the prevalence of the notifiable diseases. National Electronic Communication System for surveillance is a national system for obtaining and recording notifiable diseases. Different types of surveillance systems. There's generally you think about the two, passive and active. Passive are case reports are sent to the local health department by healthcare providers such as physicians or nurses. Laboratory reports of disease occurrence are sent to the local health department. So if person has the flu, person has an STD, that information then needs to go to the health department so it can be tracked. And then the active system, the nurse as an employee of the health department may begin to search for cases through contacts with local health providers and healthcare agencies. If one person has it, they begin to look, for others in the area. And then the Sentinel system monitors key health events when information is not otherwise available or in vulnerable populations to calculate and estimate disease morbidity. And special systems developed for collecting particular types of data may be a combination of active, passive, and sentinel events. And syndromic surveillance systems are a result of bioterrorism. These newer systems are being developed to monitor illness syndromes or events. Now, the investigation is a very important part and has specific objectives. Beginning with obtaining the magnitude of the problem or the event. And then you might want to read these on page 272 in your book, but they provide some definitions to these words here that you'll hear discussed when you're talking about different types of it's on page 271 in your book, when you're talking about different types of problems and events that are happening. So if a disease or event is found to be present, it's occurring in the population just normally all the time, it's endemic. And if there's a persistent or unusual presence with a low or moderate number, the endemic levels provide a baseline and establish whether there is a public health problem or not. For example, foodborne botulism is endemic to Alaska. That's the one that they gave in the book. And then if a problem is considered hyperendemic, there is a persistently unusual high number of cases. An example of that is high cholera incidence among persons who live in Asia and Pacific Islanders. And then sporadic problems are those with irregular pattern with occasional cases found at regular intervals. An epidemic means the occurrence of a disease within an area is clearly in excess of the expected levels for a given period of time. That's like a flu epidemic. And this is often called an outbreak. And then pandemic, which is what we always are concerned about, pandemic outbreaks such as the SARS outbreak. It refers to an epidemic spread of a problem over several countries or continents. And then holoendemic is a population that implies a highly prevalent problem that is community acquired early in life, and it decreases as age increases. And then outbreak detection is identifying an increase in frequency of a disease above the usual occurrence of the function of the investigator. The investigation, if you're looking at patterns of occurrence, there are some specific definitions for that also. Common source outbreak are, for example, children from the same school with coughing, flu symptoms, or rashes. If it is a point source pattern of occurrence, all persons become infected at the same time. That would be an example of everybody ate some food that was contaminated. Mixed outbreak is exposed to secondary source such as a Shigella exposure through food contamination. A person had Shigella prepared food, and then the food becomes contaminated and then becomes a secondary source. And then intermittent or continuous source, exposure over days or weeks as contaminated foods are prepared and served. And examples of this are like peanut butter that was contaminated, and or when there's like a recall on ground beef or other foods that you've heard about in the media in recent months and years. And then a propagated outbreak is no common source, and it spreads very gradually, such as the spread of tuberculosis from one person to another. And then, of course, the causal factors are from the epidemiological triangle. You take into consideration your agent, your host, and your environment. And then when you investigate, when would you investigate? If any time that there is any unusual disease incidents, then you would definitely investigate this pattern occurrence. Okay, and when do you intervene? Um, a response to, for example, response to a large-scale infectious disease outbreak may require the use of emergency public health measures such as quarantine, isolation, closing public places, seizing property, mandatory vaccination, travel restrictions, and disposal of the deceased. And that, I think we've seen a lot of that with Ebola that has been in the news. And protecting healthcare providers from exposure, including the use of standard precautions when coming into contact with broken skin or body fluids, and the use of disposable non-sterile gowns and gloves, followed by adequate hand washing after removal and the use of face shield. So every step of the isolation and universal precautions and standard precautions must be taken in order to prevent a break in the chain of infection and causing exposure to a bacteria. Conducting an investigation, first you want to confirm the existence of an outbreak, and then you verify the diagnosis or define a case. Then you estimate the number of cases. You orient the data collected to the person, place, and time. Develop a hypothesis and institute control measures, and communicate your findings. And you'll find in the case study this week that is part of the discussion thread, as you read through the different articles, you'll choose one and you'll look through there and you'll find the different parts of how the studies were conducted. And that's the end of this lecture.